This is a community analysis presentation on College Park, Florida, presented by Raelynn Zuk. As one drives into College Park, they will notice what a quaint neighborhood it is, located within the beautiful city of Orlando and inside Orange County. It is located about a mile from the downtown Orlando area, making it a popular residential area for over a century among seniors and young professionals. This presentation will cover a brief history and overview of the community, as well as discuss the structure, population, health concerns within Orange County, health-related resources that are available, the environment, government and public policies, community problems, and global community issues. The name College Park is derived from the accompanying streets established within its bounds that were named from prestigious institutions such as Princeton, Harvard, and Yale. In 1842, the first settlers arrived during the Second Seminole War after land grants were offered to encourage settlement. Between the years of 1864 and 1865, cotton and citrus crops were established. In 1880, Southern Florida Railroad was established, which brought many people into the area that we now call College Park. The winter of 1894 to 1895 resulted in the Great Freeze, which led to a halt in neighborhood growth for over a decade. In 1905, growth began to resume and tourism expanded. In the 1920s, the real estate boom occurred, and it was during this time that many of the neighborhood subdivisions were established. The name College Park was officially established in February 1925. Today, College Park is 3,241 square miles in size and serves home to 19,074 residents. The population density encompasses 3,663 people per square mile. As you drive through this small town, you will notice how beautifully paved the roads are with brick-lined streets. The neighborhood encompasses bungalow-style homes built in the 1900s, surrounded by lakes, shops, restaurants, and parks. Approximately 65% of households in this area don't include children, and residents of the working age are between 18 and 49. College Park is a cool, hip, trendy place that many people love to call home. Within the structure of the community is housing, schools, and healthcare-related resources. In College Park, homes are either owned or rented. There are apartments and condos available to buy or rent as well. The issue observed within the community is the lack of income-based living available. Although College Park does not offer any programs for income-assisted living, Orange County does offer a Section 8 program and a tenant-based rental assistance program that is federally funded and administered by the Housing and Community Development Division for very low-income households in need of subsidized housing assistance. College Park's community structure provides an abundance of needs to the community. In comparison to other communities, it serves its purpose by having many resources available, such as several schools to attend, public and private, and healthcare resources are readily available and centrally located as well as easily accessible. College Park is home to several public schools and 2 private schools. Public schools include Lake Silver Elementary and Princeton Elementary that provides education to children from kindergarten through 5th grade. Lee Middle School is the only public school for grades 6 through 8. If one chooses to attend a private school, one can elect to attend St. Charles Borromeo Catholic School, which has kindergarten through 8th grade. There are special requirements to be able to attend, which one can find online on the school website for information. Cost per child is $6,975 per year. There are 2 high schools in the area, Edgewater High School, which is open to all teenagers, and Bishop Moore High School, which is a Catholic private school that costs $10,692 a year. Whether you are a family with children, single or elderly, College Park offers an adequate amount of environmental resources. In comparison to other communities, it serves its purpose by having many environmental resources available, such as recreational parks for use to engage in activity to promote health in the community. There are several parks that provide means of fun like playing on the playground, enjoying a game of basketball, and sidewalks for the use of walking or running. The community center is home to after-school programs, school vacation camps, and summer camps to children of all ages. Amenities are available to everyone and include an on-site fitness center, a multi-purpose room, a gymnasium, a computer lab, game room, swimming pool, playground, and a covered pavilion. The major lake in the area is Lake Ivanhoe and can be used for water sport activities. There is one golf course called Dubstrud Golf Course, which is a great place to enjoy leisure fun like golfing, but is also a great place to spend time with friends and family and enjoy a bite to eat. After a long day in one of the parks, one may enjoy having a meal at one of several restaurants in College Park to wind down. The safety needs of residents of College Park are provided by Orlando Fire Department Station 3 and Orlando Police Department. Because the police and fire department are centrally located, they are able to respond to calls in an efficient and timely manner. Sometimes an emergency may arise and one needs to seek out medical care. There are two main hospitals located in the downtown area about 2 miles from College Park. Florida Hospital Orlando, which is a not-for-profit organization, consists of 2,247 beds, and Orlando Regional Medical Center, that is also not-for-profit, consists of 2,145 beds. ORMC is the only Level 1 trauma center in the area. Both serve as primary hospitals. However, mothers that may be of high-risk delivery or with babies can go to Winnie Palmer, which is located right next door to ORMC. All three facilities are centrally located right off of the major highway, I-4, and all accept patients with or without health insurance. Sometimes health issues arise of non-emergent matters and one should present to a walk-in clinic. CentraCare is an urgent care facility that provides treatment to patients with health insurance from children to the elderly 7 days a week, and many centers are even open until midnight. Not all patients that are admitted into the hospital are able to go home or may even require follow-up care at home. There are several long-term and acute care facilities throughout Orange County as well as home health agencies that are able to assist individuals based on financial circumstances. The main long-term acute care facility in the area is Select Specialty. Select Specialty offers care to patients with health insurance only. Preferred Care at Home is a well-known home health agency that also only accepts patients with health insurance. The population of the community presents some health concerns based upon age and race. The predominant age of individuals living in College Park are ages 45 to 64, followed by ages 25 to 34. Sexually transmitted diseases remain a big issue throughout Orange County. In regards to health concerns, data was provided for Orange County. Sexually transmitted diseases seem to be a big issue. The top two listed on the Florida Health Chart Online were chlamydia and gonorrhea, both totaling 2,203 individuals each in 2015. According to research, certain racial and ethnic groups demonstrate higher rates of infections, such as with African Americans and Hispanics. According to suburbanstats.org, in Orange County, 26% of the population is Hispanic, while 20% is African American. The leading cause of death in Orange County is heart disease. Risk factors of heart disease include smoking, increased intake in fatty foods, high blood pressure, obesity, and diabetes. From data collected throughout the community, many people were observed smoking and overweight. The overall health needs of the population should focus on health promotion and education. Education is key to prevention by being informed. The following Healthy People's 2020 objectives were chosen based on community data of Orange County. According to Healthy People 2020, 3 specific community objectives include sexually transmitted diseases, heart disease and stroke, and tobacco use. In regards to STDs, Florida Health Chart's online records report that chlamydia rates in Orange County occur at 634.1%. This objective is to decrease the amount of chlamydia infections occurring in adolescents and young adults. Heart disease and stroke rates in Orange County were at a combined total of 30.3%. The main objective of the population is to reduce the proportion of hypertension among individuals. This can be done by performing routine blood pressure checks throughout the community. When an individual has high blood pressure, they should see a doctor to be prescribed blood pressure medication. Individuals should also be educated on not smoking, proper exercise, and diet to prevent heart disease and stroke. The last objective is tobacco use. According to Healthy People 2020, among all age groups, we need to reduce the initiation of smoking. The best way to do so would be to increase the price of tobacco products to detour from smoking, establish policies to reduce exposure to secondhand smoke, restrict tobacco advertising, and reduce illegal sales to minors. The mayor of Orlando is Buddy Dyer, while the city commissioner of College Park is Robert S. Stewart. In order to reach community officials, they can be reached by phone or email. To remain up to date on what's going on in the community, one can attend a council meeting in person or view one online. Current budgets allocated will propose to increase property taxes this fiscal year by 9%. The purpose of funds will be sufficiently allocated towards public safety, health and social programs, public transportation, parks and recreation, and several infrastructure improvements. After conducting research on large amounts of community data, there were only 5 needs of the community that could be identified to aid in better overall community health of the population. College Park overall is a pretty healthy, well-established and maintained community. The following community needs will be identified on the next slide: lack of fitness centers, lack of shopping centers, lack of homeless shelters, lack of affordable housing, and decreased smoking. The first community need observed is a lack of fitness centers. A lack of exercise can have a negative impact on overall health and mental well-being. This is the #1 community need because increased physical activity is linked to better physical, emotional, and mental health and would aid in a decrease in other illnesses such as risk for obesity, cardiovascular disease, diabetes, and cancers. The second community need is the lack of shopping centers. Publix is the only grocery store in College Park. This can lead to overcrowding at times when purchasing groceries due to its small size and only grocery store. Another issue is that sometimes Publix runs out of certain food items, which makes it difficult to purchase items that are needed, especially fruits and vegetables that are beneficial to our overall health. Third is the lack of homeless shelters. The lack of shelters increases the amount of people walking along busy roadways and asking for money or food. This places these individuals in danger of being hit by vehicles. By opening a homeless shelter in the community would provide for a safe environment for the less than fortunate individuals that need assistance. The fourth community need is the lack of affordable housing. By implementing affordable housing in the community will provide a safe area for children and families to live. The fifth community need is to decrease smoking. Not only is smoking harmful to the person performing it, but secondhand smoke is bad too. Risk for coronary heart disease increases by choosing to smoke. Smoking also causes constriction of blood vessels, increasing one's chance of having a stroke. There are many global issues and community issues that relate to healthcare disparities. A major global issue in Orange County and presenting worldwide is HIV. Currently, 37 million individuals are living with HIV, and it is ranked among the top 2 deadliest infectious diseases. In Orange County, HIV is occurring at a rate of 34.5%. HIV is a leading cause of death in Africa. In Africa, the gateway to treatment lies in HIV testing. Research has shown that only about 12% of men and 10% of women have been tested for HIV among the population. This could result in a lack of timely diagnosis and proper treatment, as well as spreading the disease to one another. According to research, there is a global fund that's being used currently to aid in diagnosis and treatment of HIV. The best way to deal with the issue globally and in the community is to educate on the importance of getting tested. There are many centers available that provide free HIV testing. In Orange County, the Area 7 HIV and AIDS program at the Florida Department of Health is available for patient care, prevention, and surveillance resources. As a community health nurse, we can help educate the community on the importance of using protection while engaging in sexual activity. We can also educate the community on how to access community health resources to receive proper HIV testing and counseling. Due to the development of new antiretroviral treatments, HIV is becoming a more manageable health condition, resulting in a decrease in mortality rates. This concludes the community analysis presentation.